Hey there, welcome to the channel. I'm Dr. Andrew Smith. I'm a psychologist, a professor, a Tillman Military Scholar. For the past 15 years, I've been studying how people connect, how stress impacts us, how relationships can make or break our lives, our meaning systems. Today, I'm going to break down the limitations of the kind of therapy you may have had exposure to, second wave or traditional cognitive behavioral therapy or CBT. I'm going to explain how Rewire offers a fresh, action-based, and relationship-centered alternative. In this, I'll touch on the importance of aligning actions with values and relationships in a way that can help you achieve lasting, sustained change and congruence with yourself and who you'd like to be. Whether you've struggled in therapy in the past or just want to build healthier connections, Rewire might be an approach that could be really helpful to you. So, if you're feeling disconnected or like traditional mental health approaches just don't speak to your real needs, you're not alone. Rewire is all about building deeper, more meaningful connections, finding purpose without labeling this process of struggling through life as particularly pathological or diagnosable. Relationship friction and suffering is not a pathological state. It's a universal given. I have it and you have it. And you don't need a diagnosis in order to move towards healing. That's what we're all about. Check out rewirewellness.co. If you're new here, don't forget to subscribe and link to our website in the description, rewirewellness.co. Because today's video, I think it could really change how you think about mental health and relationships and whether or where you can get some help for that. So I'm going to break it down into 4 key parts today. So bear with me. If anything resonates with you or if you have questions, drop a comment below. I'd love to start a conversation. We're going to start with talking about the shortcomings of traditional CBT. But in order to do that, I just want to lay down a few of the basics about how traditional or second wave CBT works and what the data say about how effective or impactful it could be for the kind of things that maybe you could use help for. So, second wave CBT. It came out in the 1970s. This really comes from the school of Aaron Beck, and it's been the dominant approach for the last 3 or 4 decades. It was revolutionary for its time. And the core idea, in response to the stark behaviorism of its time, the core idea in second wave or traditional or Beckian CBT is that the ways that people suffer arise from really fundamental distortions or problems with thinking. So the 2 key components here are distorted thinking and therefore if distorted thinking is the source of suffering, then the solution is to restructure. And that's the language, thinking. Okay. Therapists are trained to help clients identify cognitive distortions like black and white thinking or overgeneralizing. The goal then in therapy is to challenge these thoughts and replace them with more accurate ones. Sounds good, but there are 3 key problems with this. In this model, therapists are the experts. They observe, they hold the objective truth about what is a cognitive distortion and what is aligned with reality. So they have some objective knowledge about what is non-distorted thinking. So through the therapy relationship, patients speak and therapists are honing in on what kind of thinking they're having that's distorted. And cognitive restructuring in these second wave CBT approaches, it occurs through exercises and any active component of the treatment, like behavioral activation, homework assignments, they occur as a means of producing better thinking. Everything drives back to that. So even behavior, getting you moving in your life, is explicitly designed to restructure the way that you think. So we're going to talk about some of the problems with this approach, and these problems form the context out of which Rewire, which is the approach that I've designed, has come. So problem 1, let's use the whiteboard some more. What do the data say on effectiveness. So effectiveness is what we're after here, understanding. So given that this has by far been the most dominant approach, there's a way that happened. And let me just lay a little bit of history and context for this. Second wave cognitive behavioral therapy approaches that focus on distorted cognitions, they've come about in a time, in an era, alongside tools and methods that allowed us for the first time really to start conducting rigorous medical model like research like they do in pharmaceutical companies or trials, randomized control trials that allowed for the rigorous study of psychotherapy really for the first time. So these approaches really got force magnified alongside an era of tools and science infrastructure. They were kind of in the right place at the right time. And here's what the research shows without going into too much depth. Over the last 4 decades, while second wave CBT has been and can be effective, its impact is actually declining over time. So its impact or effectiveness is declining over time. Several seminal studies in the past decade, starting in 2015, have started to try to understand effect sizes or the extent to which these second wave CBTs have positive impact on individual people's lives, and have shown that the effects have started to dilute over time. I think there are a few reasons for this, and I'll conjecture a little here. Perhaps the main reason is that these have been popular, and this science infrastructure boom has marketed these approaches and disseminated them really widely. These concepts that underlie second wave CBT approaches are so infused in our culture and our language now that the novelty of these kinds of approaches when you step into a therapy office has diminished to quite some degree. So one example might prove this out. Have you ever heard of black and white thinking? That's probably one of the most common types of distortions that is in our common parlance. We probably all have heard of this. It's a key distortion in this approach, and many have taken it as part of our common language now. So let's talk about not just impacts across time in our culture, but let's talk about other data that basically review our most rigorous studies and look for and conduct math around the impact for individual level people. So our best studies are RCTs, our most tightly controlled studies, and these things get aggregated into meta-analyses. Basically, the most rigorous studies pulled together, and we come up with a common set of metrics for how effective we think something is. So among people who complete these second wave CBT approaches that focus on changing thinking, cognition, about 2/3 of people retain a diagnosis. Meaning 2/3 of people who complete these treatments, let's say you walk in with a depression diagnosis or a PTSD diagnosis, you're not walking out after an adequate dose of therapy, which is 6 to 10 sessions, with the remission of your diagnosis to where it's low enough that you would no longer meet criteria by some evaluation. So let's complete the whole. Let's do a little algebra equation. 2/3 plus x equals 1. So what equals a whole? That means 1/3 go into remission. 33%. And all we're talking about here are the people that actually completed an adequate dose. If you really laid this out and you considered the number of people who come into these therapies and then drop out of therapy, which is about 40 to 60%, you're really talking about a small number of people who benefit significantly to the point that they no longer meet diagnostic criteria for these kinds of disorders. So let's complete that math. So 100 people come in to a study or into a therapy office. Right off the top, 60, let's say 40 drop out. We'll be generous. minus 40 equals 60. And now these numbers only apply to those 60. Of those 60, 40 don't experience the remission of their condition, and 20 do. 33%, 1/3 of 60. Does this seem acceptable to you? That of the 100 people who walk into a therapy office, 20 of them receive the kind of benefit that they'd want. Does that sound acceptable to you? It doesn't to me. And it's one of the reasons why I developed Rewire. Because 20 out of 100 people coming into therapy and getting what they need doesn't work for me. What has happened is the medical establishment has closed ranks around these types of treatments, in part because of the sunk cost fallacy that's playing out. We've put so much money into labs and trials and centers and infrastructure for second wave CBTs that focus on changing people's thinking. We continue to tout the need to disseminate these types of approaches when in fact the data suggests that we're kind of trying to squeeze water out of a rock at this point. They have significant limitations in what they can do, and it's not just a scaling problem. So I'd love to hear from you in the comments below. Have you had an experience in therapy where you went in earnestly seeking help with something, only to experience the treatment as ineffective or not responsive to your needs and goals? So let's shift to problem number 2. Problem number 2 is all about access and scalability. Access, scalability. So we're moving beyond the problem of effectiveness, and we're moving into the second dimension of problem, which is access and scalability. So these kinds of second wave CBT approaches require 21 to 23 years of education if you add it all up. PhD level, doctoral level education. Look, working with abstract cognitions that live under the hood inside someone's head and that are accessible only through the words that they're sharing in therapy, it's a really complicated process. It takes a lot of skill to learn to do that well. That's not simply not scalable for everyone who needs help today. So these approaches are hard to access at the level of expertise that they require to be delivered well. So for consumers, we also cover the cost of these approaches. That 21 to 23 years of education, that's an expensive cost for consumers. There's also a time burden to complete and engage in an adequate dose of treatment in second wave CBTs. Anywhere from 6 to 10 sessions. I talked about an adequate dose earlier. Mostly delivered through hour-long sessions in brick and mortar settings, even despite recent advances in telehealth. So it's just not reaching people unless you have a lot of money or time to access one of the very few experts who has enough education and training to deliver these things. So access and scalability to these things can be problematic or is problematic. So I want to move on to problem 3. And problem 3 was really the thing that tipped me over into deciding to develop Rewire. And this is, for me, an authenticity problem. It's also a fit problem. So these approaches are designed to treat mental illness. They're designed to treat diseases, these second wave CBT approaches. Sick people with diagnosed disorders. But what about the rest of us who just need support with everyday challenges? Traditional CBT, second wave CBT, it doesn't fit the bill. It's looking for sick thinking in people's lives. So this is especially problematic now, I think, with rates of generalized anxiety and depression, trauma exposures, and loneliness or disconnection, family discohesion, community lack of cohesion, that's impacting a huge percentage of us. We have seen those rates with young people, teens, middle-aged people, older folks rise steadily, forming this new baseline of general struggle in response to the many stressful conditions we find ourselves in 2024. Things that people would want help navigating that aren't pathology based, that aren't mental illness based. There's plenty to be anxious and sad about right now: climate, wars, politics, social disconnection. This isn't disease, it's a normal response to a serious set of challenges. So I found myself being trained in these second wave approaches and taught to work with people perhaps who were struggling with normal stresses of life. I was taught to identify the disease in their system. The onus on me of being an expert deliverer and framer of objective reality also really didn't fit. So there's something in the data that we're really, really sure about when it comes to why people come for therapy. 96% of folks come to therapy because their relationships are suffering. Their number one priority and goal is around improving something about relationships. Instead of saying, okay, what is it that we should focus on that you came here to get help with? These second wave approaches are saying, okay, where's your thinking distorted so that you can think differently about relationships or your suffering? It didn't work for me, still doesn't work for me, or for the needs of my patients, but I didn't have another choice at the time. So in response to the problems of effectiveness, scalability, fit, and authenticity, I started to think about what it would take to develop something different. And Rewire, over about a 5-year period of time, started to emerge in my clinical practice and started to learn how to measure it and study it. So if you're new here, by the way, don't forget to subscribe and link to our website in the description. Now I'm going to enter the second part of this conversation today. So we're talking about this evolution from second wave CBT to now I'm going to start talking about the entry of third wave. And from there, Rewire. Okay. So how do we move forward? Enter third wave CBT. This approach moves away from the idea that the therapist is the all-knowing expert. I do have expertise as a therapist, but the entry point into change for people is not through me identifying errors in thinking. It's through committing to and connecting together with a client to their goals and motivations. So instead of focusing on distorted thinking as the all-knowing expert, these third wave CBT approaches really focus on the client's values, goals, and aligning actions with those. So instead of saying, okay, you're struggling and need some help, let's figure out how your thinking is distorted and we'll restructure that. That's a second wave approach. This third wave approach says, okay, let's tackle this together. What are your goals and values? Why are you here? How can I help you align better actively with those things and notice where you aren't aligned? So the foundational assumptions in third wave approaches are much more aligned with how people really are motivated and operate. So they're focused on patient goals or client goals and values-led action. Okay? So second wave CBT thinking, third wave CBT, let's get back to some values-led action that aligns with your goals better, how you're living those out. And then Rewire niches down even further. So Rewire starts with this third wave philosophy shift, and it further drills down specifically into improving connection and relationships. Why? Because relationships aren't just one random part of well-being. They're the cornerstone of our mental health and meaning. Without them, things feel dry, accomplishments feel dry, life feels empty or can. So when relationships suffer, everything else suffers too. So Rewire steps into a third wave CBT philosophy that orients around patient goals and values-led action, and further niches down or focuses in on how these play out in relationships specifically. So now we're going to talk about how Rewire takes this further by focusing on relationships, not just as one part of well-being, but the cornerstone of mental health. So life is not lived in a vacuum. We're not just focused on fixing you as an individual or healing for an individual. It's not about diagnosing and fixing pathology. It's about healing and improving the connections that give our lives meaning. This is the universal that connects us all: relationships, and the struggle to have them, and the struggle to be happy and meaning filled through them. So if you're coming in with a history of struggling with mental health, let's say that you have a history of mental health diagnosis. Let's say that you don't know history, but you are struggling nonetheless with problems of living, meaning, and connection. Relationships are a shared connection, is shared by you both. It's critical. I'm not the only one who says this. Tons of data back this up. The centrality of relationships and being healthy and joyful and happy. So if you're coming at this from a history of mental health diagnosis and traditional therapies haven't been helpful to you, social support moderates or determines the extent to which you experience more meaning in your life, experience lower symptoms of mental health problems, lower depression, anxiety. And if you're coming at it from no history of mental health diagnosis, but you're struggling to live nonetheless, relationships are central as well. They moderate the extent to which your life is filled with meaning and presence and joy. So what makes focusing on values in relationships? Remember, we're using this third wave philosophy. Let's break it down a little bit. And let's continue to do a comparison with the difference between focus on, I'm saying this a couple different ways. We're going to continue to do the comparison of focusing on traditional CBT or second wave CBT approaches, looking at thoughts versus this focus on relationships through action in this third wave Rewire based approach. So we'll call it second wave versus Rewire. Okay. So remember, maybe I'm beating a dead horse a little bit here, but I think it's important to really capture the nuance and the difference. So traditional or second wave CBT, it focuses on internal cognitions, changing distorted thoughts, changing irrational beliefs, trying to alter how you think. It's very much an inside your head process. The therapist's job is to help you see your thoughts and where they're flawed and help you think differently. So it's inside, it's internal. There's a problem with focusing on the internal, other than the problems that I talked about earlier around access, scalability, effectiveness, and authenticity. There's a more fundamental problem in the change process. And that is that focusing solely on thoughts, it doesn't always lead to real change. People get stuck in loops of thinking about their thinking, which can lead them to feel passive, stuck, even more disconnected from other people, especially in our information overload age right now. We spend a lot of time in our information streams thinking our thoughts. So Rewire's different. It's action. It's epiphenomenal. It's manifest outside of my body towards other things, towards other people. It's about action towards people using my values to guide. Instead of spending time challenging passively my thinking, we're focused on aligning actions with values, especially in relationships. So in Rewire, we ask, are you behaving in ways that align with your values and your closest relationships? If not, what actions can we take to move you towards those values? Let's come up with it together. So values lead to behavior. And a focus on this leads to behavior. By focusing on what truly matters, connection with other people, you can see quicker, more meaningful changes. You're not just thinking about improving your life, you're actually thinking about living it out in your relationships. So remember that statistic that I shared that 96% of people who come to therapy are struggling with relationship issues. Whether it's a partner, a parent, a child, even a coworker, relationships are at the root of most people's emotional and psychological pain. It's not just me saying this, tons of research backs it up. Social support, relationship health, they're the biggest predictors of mental and physical well being. Strong relationships lead to better outcomes in everything from depression to anxiety to stress management, even physical health issues like heart disease and adherence to difficult medications and cancer diagnosis, for example. So, Rewire, this thing that I've designed, it's the only approach that focuses so deeply on relationships at the front and center. Instead of trying to fix individual thoughts, we focus on helping you build and maintain stronger, healthier relationships. When you do that, everything else falls into place. Your mental health improves, your sense of purpose grows, your overall life satisfaction skyrockets. So if you're tired of feeling stuck in your own head, or if therapy hasn't clicked for you in the past, or if you're too maxed out already to have time for traditional therapy, if you don't want to live in this passive, in your head space and you want an action based, virtue and values directed way of improving your relationship with yourself and the people in your life, I encourage you to try something different. Rewire is about living out your values in your relationships, not just talking about your problems, but actively improving the way that you connect with people who matter the most. So now I want to hear from you. Have you tried therapy before? Did it help? Drop your experiences in the comments below. And if you're ready to take next steps, join the approach and community that we're building here, moving towards a different way of rebuilding the musculature of how we engage and interact with one another. Go to rewirewellness.co or rewirewellness.co and expect me, I'm an academic. I'm a therapy intervention designer. I've been living my life in peer-reviewed journals and on an academic path, but I'm finding that I need to engage through these other channels in order to get this work out there. I think it's a really valuable way to start communicating with folks. So that's my commitment to you, is weekly content on this. I'd love you to subscribe and support what we're doing here. All right, I think that's it for today. If you got something out of that video, if you found it helpful, there's plenty more. Check out the other videos on this channel. And over the coming months, trust me, there's going to be a lot more, so stay tuned. We're also really excited about building this community, so you can be a part of that. Subscribe, comment below, let us know what resonated with you, and also visit our website, rewirewellness.co. Let's build this community together.